You can make me watch any movie you want. Check the tier out on Patreon. What's up everyone and welcome back to my Vision, or welcome if you're new here. I'm Mado and this is the Pitt Season 2 Episode 8. We're gonna go into the crisis and we're gonna see how they're gonna react and how they're gonna treat the patients and stuff like that. My mom actually told me that she watched this episode and she told me like they are working now like the hospitals we have right now in Lebanon. So that's funny because I guess this episode's gonna show how they're gonna like struggle a bit with no power, with no technology or stuff like that. Where I live, it's like that's the normal for us in hospitals here, so we'll see how it goes. Anyways, if you guys are new here, subscribe, and also if you want the full, long, juicy reactions, they're on Patreon, and let's reply to episode 8. My Patreon includes full reactions that do have the movie or the episode in my video, and also there's a tier that you can make me watch any movie you want. Link in the description box below. On my face.
Next time, maybe inform the department chair before the shit hits the fan.
I was on my way to tell you. IT called me up because I've trained in cyber attack prevention and response.
Oh, really?
Okay, everybody settle down, listen up. As you can see, we're doing a little redecorating in the central work area.
Oh, God.
Could be up to 24 hours.
Jesus.
Damn.
So please, somebody tell me they got a photo of the boards.
Yeah, right here. Okay.
Oh. I thought he took a selfie. He did, but then he switched the camera.
Sorry.
Oh my God.
It's blurry.
I remember.
Anybody else can remember their patient names and their room numbers? That would be
No,
awesome.
I mean, I can remember all of it.
Really?
Kind of have a photographic memory.
Seriously, the whole board?
The whole board?
All chief complaints will be abbreviated, so HA for headache, AP for abdominal pain.
Oh.
Central 10, Jackson Davis, new onset psychosis.
Her face.
It could be a while.
Princess has charge nurse experience.
Not really.
Great idea. Princess it is. You can make the nursing aside.
There's no way she remembers the whole board.
Oh, ow, that hurts.
That translation wasn't needed.
Pick up a new patient, you grab a fresh chart from the T system.
Pick your chart by chief complaint. Use the cartoon.
For the history, circle the positives like vomiting and diarrhea, backslash the negatives.
That's too much. This is still organized though.
Are the CT scanners still working?
Yes, but the results will come back on paper from the radiologist.
This is
Yeah.
the Dark Ages.
So
Dark Ages. That's how we actually have it here. I'm not gonna lie.
I'm sorry, who are the clerks?
you're looking at
Larry and Antoine are filling in until more help arrives.
Discharge chart goes here. This lets everybody know we're about to have an open bed.
Yeah.
this is our lifeline to labs and x-rays. When the results come back, they will fax to us and the clerks will put them on the charts.
Wow.
Howard Knox, 52, abdominal pain
Oh,
and
shit.
fever, 152 over 90, tachy at 120. Couldn't get an IV.
Wonder why.
Bupivacaine Central 12.
Wrong spot, Dr. Santos. And you need a sticker.
Oh God.
Today will be an adventure. Think of it like Back to the Future.
That's literally how it is now for us. We all like write on papers. You can see them all like standing writing. That's crazy, the difference between countries. Shit.
Oh, ow, that really hurts.
Sorry.
And on this side?
Yeah.
Sorry.
Everywhere?
I'm gonna have to put a tube in your windpipe to help you breathe. Are you okay with that?
Intubation with rapid sequence induction.
No, we can't lay him down.
No, the tube will go in your nose while you're awake, sir.
Oh.
Is it possible that you might be over 450?
Possibly.
If surgery is necessary, then your weight could make things a little bit more complicated.
I know, I'm sorry.
Not to worry, we're gonna take very good care of you.
He said I'm sorry.
Plus our CT can only handle 450 pounds.
And so if he's over that, we send him to the zoo.
He's right there.
I heard that there's a large animal CT at the zoo.
If Presby's still up and running.
Have any of you ever done an awake nasal trachea?
I hate Jonovi, whatever his name is. Bajoni.
I've been assisting with Roxy's care.
Oh, thank you so much. I'm Lloyd.
There's a fracture down by the ankle. She's in a boot now, so there's not quite so much pain, but I'll take you. She's just at 9.
Why is everything so quiet in this episode?
You know, it's getting pretty crowded in here. Maybe we should take Tucker and Shane out for ice cream.
Yes, please.
No, I'm okay.
Maybe your mom would like some time to rest.
She's barely talking.
Can she have ice cream?
She can have anything she wants.
Come on, let's go.
That's honestly a sad sentence. She can have anything she wants. That's sad. Because if there's evidence or a hope for improvement, then she wouldn't be able to eat anything, everything, you know?
Lisinopril and metformin.
Ozempic, Wegovy.
No, I'd walk more, but I need a bench to rest on every block.
What about water aerobics?
Let's focus on
Shut
health,
up!
Mr. Knopf.
Exactly. Oh, it's so annoying.
Car crash, burn unit, 4 leg surgeries over 10 years.
I need to numb the back of your tongue. This is gonna taste pretty bad.
Siblings?
Sister in Arizona. We don't talk much.
That's so sad.
Sorry to interrupt. I have a middle-aged woman with sudden onset blindness.
Blindness.
Just gonna go over your tongue
Ugh.
and numb your vocal cords.
I don't see any fingers.
And now?
I can see a little bit of light.
That's so scary.
In English, please?
A little blood clot can block the artery at the back of the eye and decrease your vision.
Sometimes it's called an eye stroke.
Stroke? Like she could be paralyzed?
No.
Any more comatose patients for me to have a chat with? I'm kidding.
Okay.
Victoria.
I'm scared. I feel like it's so bad.
How's it look?
Extremely pale, no blood flow.
Digital massage 10 seconds on, 5 seconds off. Order non-contrast head CT.
They've never been in a hospital, you can tell.
Maybe you could ease up with your comments about his weight.
Yeah.
I was just wondering how he got so big and how we could help.
We can help by finding out what's wrong with him and treating him with respect.
Exactly. Someone needs to shut him up.
Slowly over a few minutes, I'm gonna go deeper, all the way to the back of my knuckle.
Oh.
Once the tube's through your vocal cords, you won't be able to talk. But this is a communication device.
Robbie, over here.
Here we go, head back.
Oh.
With his size, an emergency open laparotomy death rate's close to 50%.
Okay, one step at a time.
Sudden onset blindness patient has central retinal artery occlusion. Principal investigator for thrombolytics in cases like this.
Not exactly standard of care, kind of risky.
Do informed consent. It's our best shot at saving some of her vision.
Your patient, your call.
I mean, that sounds...
Taking 2 swabs from the vagina.
That sounds like you, Robbie. Something you'd do.
One last thing. 4 more swabs inside your mouth.
Didn't you do that already?
Inside your cheek for your DNA. No BS.
A blood test or a brain scan that'll tell us for sure?
Unfortunately not.
And properly medicated people with bipolar disorder can have successful careers.
So we hope for bipolar.
You can hope for your son's happiness.
People with schizophrenia have a complete recovery.
So 80% don't.
That's so sad. Oh.
Good to go.
How'd that feel?
Do you want to try it?
What day and time is it?
4th of July, 2:31 p.m.
I know, just practicing.
It's that easy? Nice.
I just want to say thank you for everything.
You're very welcome.
Oh. It's big.
I'm glad you were here today.
Me too. Studies have shown that some vision can be restored with a clot-busting medication.
So get it.
2% of patients who receive the medication get worse, and 1% have severe disability or death.
Oh, death. Death?
Honey.
What do you mean death? How would that... I want to know.
And you are her friend Jackie?
You have the same name?
No, she's Jackie with the CK, I'm Jackie with the Q.
What happened?
I fell out my tongue.
Oh.
You should hear her when she's had 2 pictures of margaritas f***ed up and slurring.
Hello. I'm Dr. Langdon. I'll be supervising your care.
He's a CK, your doctor's fucking hot.
Blue mark tells me I'm in the tube.
Oh!
Until we see the carina.
Days, where are we?
And the scope comes out.
Ugh.
Are you f***ing kidding me?
What?
Is there a problem?
Police are supposed to pick up the rape kits within 72 hours. This one I did 2 weeks ago.
Very nice. Until she jerks her head up.
What?
This is a numbing shot for the tip. The tip? That's not where I bid it.
One step at a time.
Ouch, on her tongue? Oh.
We're going to move you to another room for better monitoring. I'd like you to stay with her.
Not about the blood clot in my leg. I just kept thinking it's going to go to my lung and kill me.
Oh.
Well, I finally took your advice. I joined the Frick Park Lawn Bowling Club.
Wonderful.
Oh.
I mean, you're right, you know. We all need a community.
That's true. That's so cute. It's so sad that even older people are still scared of death, you know?
What size suture is that?
Oh, silk. The biggest one we got.
Her tongue? I've never seen that before. Oh.
I got a rape kit sitting here for 2 weeks, so it's supposed to be picked up within 72 hours. You expect us to treat your officers as soon as they come in? You get a detective to pick these kits up ASAP.
Come on.
All right, I'll send a reminder.
Hey, Dana.
Hang on.
Oh. That's exactly how it is now.
What's that noise?
UFO landed. Aliens are invading.
My mechanic friend Duke never showed up.
Thought he was coming in this morning.
That was the plan. I guess he got busy.
What mechanic friend?
How's your first shift back going?
One day at a time.
In 9 years and counting.
Yeah. He didn't know that?
If you need anything, call me.
Thanks.
Oh, thank you. He needed that.
Where are you going?
Blisters in North 3.
That's where I'm going. Whatever. Hi, I'm student Dr. Ogilvy, and this is wow. And have you been on any hikes recently around poison ivy?
Oh, his face as well.
About new medications, lotions, soaps, detergents even.
I don't take medicine, nothing new with all that other stuff. What are you thinking?
I have no idea.
Really? What the heck?
We need to check for pustules, mucous membrane involvement.
And the Nikolsky sign.
That was nice. They teamed up a little.
Any changes?
Not so far.
It's time for the next neuro check.
No, I'm observing a patient right now. 60 seconds tops.
She wanted to stay now.
I just finished my deposition.
Oh.
Oh, it's a monologue, so shut up and listen. The mother of the measles kid claims we caused intellectual decline by performing a spinal tap, but the tap was perfect with no complications. Any change in intellect was due to hypoxic brain injury. It had nothing to do with your spinal tap. End of monologue. I gotta get some sleep.
Thank you.
Thanks.
2, 3.
They gotta weigh him like this.
Lifting up now.
Sheesh.
215.
That's in kilos.
Oh, kilos. 70. Oh, my thing. This poor guy.
Can the medics take him while he's intubated? If I go along for the ride, I could still get a nap in before my night shift.
Oh. Ouch. His back.
Sorry for all this trouble.
It's okay. This is what we do.
If you would feel shame and... Oh, don't cry. It's gonna make me cry. You would feel like you're a burden, you know?
You know, I've been thinking about applying for a fellowship. Have you considered a geriatrics fellowship? I've seen your skills with the elderly, and there are a lot of openings. It might be your best shot. Think about it.
Okay, Jackie.
Maybe we should recommend rehab?
You got meds if you need them.
Scan will be quicker than the ride to Presby.
We'll keep trying to reach your sister.
You guys are the best.
See you later.
You guys are the best. Oh, this guy.
Looking all over. Where you been?
With Louis?
Been there for an hour?
He was my friend. Had a lot to say.
An hour?
Dr. Robbie, we picked up a patient together.
Teamwork.
I asked. He was making 3 gallons of margaritas for a party, squeezing fresh slimes out in the sun.
Let's go take a peek.
Oh, wow. She asked. They didn't even ask.
You got the security pads?
Sure do.
Yeah? What would have happened if you weren't here today?
You'll be curled up in the fetal position, crying like babies.
I know, that's right.
Were you wearing flip-flops?
I was.
Some people, limes plus sunshine can cause a horrible rash.
Really?
Once these heal, you gotta wear sunscreen because these blisters can turn into dark scars and stay a while if you don't.
Damn.
My hospice patient Roxy's still in a ton of pain.
Where are we with the morphine?
10 milligrams an hour.
Okay, you can bolster another 2 and go up to 12.
12 an hour is a lot.
Yeah, on top of the MS cotton, she could stop breathing.
Oh, shit.
Are you familiar with the doctrine of double effect? It is an ethical principle in palliative care. We treat pain. And if in doing so there's a negative side effect, we accept it.
Oh, shit.
Side effect is death.
In some cases, that could be the best outcome.
So she just won't be in pain while she dies. Oh my days. Oh my days.
How are we gonna get through this mess?
I was about to ask you.
No! No! I wanted more. Bro, that felt like 5 minutes. Okay, well, that was the Pitt episode 8. That was a good episode. I enjoyed it. As I said, the way they were acting, the way they were treating patients, for me it's still organized, but it did remind me of how we have the hospitals here now, still doing it like this. I think we only have like 5, maybe 4 hospitals that are more advanced, you know, they don't do papers like this, but most of them have paperwork like this. So that was not like shocking or crazy or chaotic to me. I'm used to seeing them do this like that, so which is crazy, you know. The difference in economy shows here, it shows. But yeah, other than that, good episode, went by so quickly. I'm glad that Dr. what's her name, I forgot her name, when she spoke with Langdon and told him that you can call her because she's been sober as well. You know, that's nice. I don't think he knew that because he was a bit shocked when she told him she's been 9 months sober, something like that. But yeah, I like that. He did to hear that. And for that obese patient, I felt so bad, you know, because he wasn't like rude. He was actually nice, and he knew that he would be that he needs more, that he requires more care because of his weight, and he did feel like a burden. That's so sad. That's honestly horrible. But yeah, I'm glad that they were respectful. But that Oglovi, whatever his name is, get him out of there. You know what? He barely respects any patient. Like, what are you doing here trying to be a doctor? I'm over it, honestly. Santos is better now. Yeah, both of them can go to hell. I'm joking. What else? Also, the woman that can't speak, I thought her case would be more serious. It turned out to just be pain from, you know, laptop or whatever. It wasn't that serious, so that was okay. Most of these cases aren't huge, serious cases, which is the opposite of season 1, you know. I'm waiting to see what's gonna happen more. I love the show though. I love it so much. So yeah. Anyways, if you guys are new here, if you guys enjoyed my reaction, what the fuck am I talking about? I'll see y'all in episode 9. I love y'all. Take care. Alright.